You awake now? Very powerful stuff. A huge debate in healthcare, and one of the themes of the reform that's going on in Dental Health Service Victoria is that whilst you never forget that the mouth is part of the body, the rest of the healthcare system tends to forget that. And that person is part of a system. And the system of healthcare that we've got in Australia, and it's no different from other countries around the world, is that we complain a lot about there are no resources, there's no money, there's waiting lists, and yet we don't self-examine enough what we do on a day-by-day basis clinically. It's estimated that anywhere up to 30% of what we provide in healthcare across Australia is waste. It's low-value care that doesn't need to be done, and those resources could be expended on higher value care. And oral health, and dental care cannot be any different. And the question is, what are we doing in dental care that really does not really need to be done, so that the money and time we spend with our clients, and this should apply to the private sector as well as the public sector, is what really benefits them for the expenditure of money. And the idea here is that you could actually do an awful lot more than we currently do if we got rid of low-value care. It's a challenging conversation. It kind of threatens our pre-existing notions and prejudices, but it's an it's very hard to ask for more money for a service if you haven't examined yourselves for what you're doing that's low value. And that's what Deb Cole, CEO of DHSV, is going to be talking about right now.
Thank you, Norman. I'd also like to pay my respects to the traditional owners of the land on which we meet today, and particularly elders past, present and emerging. And I'd also like to thank Jamie for reconnecting and making me feel a bit calmer before today's presentation. What Norman had to say, and I think what you heard a lot about through most of the morning, is that this is a really important engagement space for all of us. And from Dental Health Services Victoria's point of view, we believe that value-based healthcare is actually the important way for us to deliver that. And it would be even better if I could work out how to work this item. Sorry about this, I'll just get my act together first. Can I just ask if I'm managing this or not? Anyway, I'll start talking a little bit about what we're doing, then I'll work out my slide deck. It shows you that my age, and I probably have a bit of technological difficulty. I'm a bit of a Luddite sometimes. Firstly, with respect to value-based healthcare, we need to make sure that we understand what the concept of value is. A lot of people, when you hear value, we're talking about things like value as in the values that we have, that things that we have in our hearts each day. And the other thing that we can think about is in relation to value with respect to cost. And a lot of people think yes, that one, thank you very much. We're thinking about cost, when in fact one of the things that we are talking about from a value point of view is about how do we actually improve health outcomes that matter to patients over the cost of delivering those outcomes. And so it is a really important concept. It's not just about the bottom line. It's not about just getting the cheapest way of doing something. It's about making sure that whatever we do for somebody actually improves their health outcomes and that they actually matter to the person that we're caring for. So one of the things that we're striving to do is to make sure that every time we make a decision about doing something or doing something differently, that we have that value equation in our mind. Are we doing something that actually improves a health outcome, and are we doing it at the lowest price that we possibly can do it? So keep in mind that that's the sort of paradigm that we have all the time when we're speaking. Some of you may have seen a number of these slides, but I'm going to go back and just remind you of some of these things. This is the next version of our story on value-based healthcare, where I'm going to concentrate a bit more on what the future state will be, because we've done quite a lot of work and I want to talk about that today. But it's important to sort of just re-establish that, you know, we have an agenda, a value agenda that is a lot of people around the world have. We want to achieve the best health outcomes at the lowest cost. We want a very person-centred system that's organised around what patients need, that we will have the right services at the right place. And a lot of you have been involved in things like teledentistry. You've been involved in a number of things where people are going out to provide services in communities, in outreach versions. So we're already well and truly doing a lot of these things, but it's about how do we make sure we get the best value when we deliver them. And obviously we want integrated care, and we need to measure outcomes, actually measure health outcomes. So one of the things that we do need to remind ourselves of the fact that, you know, why do we want to change everything? And Zoe spoke about it in her presentation right at the beginning. There are a number of reasons why, and I think you need to look at it, the why, from three different components. One, from the system perspective. So if you look at right across the world, people are talking about, you know, we've got an ageing population, lots of chronic disease, lots of new technology, rising consumer expectations, all of those sort of things. And also that we've got huge variation in both the service delivery and outcomes and in the types of services that we're providing. And quality is very different from one place to the next. And so all of those result in increasing costs. But for a lot of providers and patients, they go, well, we don't really care about that too much. Providers look at it very differently. All my conversations with many of you in this room and others is that you keep saying, look, I've been doing this for a long, long time, and I don't actually think I'm making any difference. You look at the lovely quote that Lynn gave from Albert Einstein. I mean, we keep doing the same thing and expect to get different results. We're just kidding ourselves. And I think most of you have realised that and think, I actually get into this profession to make a difference. So why am I not being successful in that? So most of you want to make a difference in what you're doing. And from a consumer's perspective, when we talk to consumers about what they want, they say, we actually don't want our life to be interrupted by poor health. We're not interested in that. We actually want to be healthy. We want to be able to participate in society, go to work, do all the things with our family and friends. And we don't want to be talked down to. We don't want people to not appreciate the fact that we're important, that we're part of the system. And I heard a lovely quote from somebody, I think it might have been last year, some of you might have heard it, but a woman who was saying, you know, this is my body, my decision. And in the healthcare sector, quite often people don't feel that opportunity. So from the why perspective, there's lots of reasons. There's the system why, there's from the provider perspective, and there's also from the consumer perspective. So at DHSV, we thought we do need to change. We've got pretty clear reasons why we need to. So where did we start? So the first thing we did is we looked at the Harvard model, where we took a particular article from Porter and Lee, Michael Porter and Tom Lee, and they basically gave us a map for how to do it and a pathway. So we said, that looks pretty easy, we'll just go and do that. Then we took that and adapted it to Dental Health Services Victoria, or in fact we adapted it for what we thought was the public oral health sector. And the circle that you can see there on the right is all the different things that we thought we needed to do, starting from the fact that we already had a very clear strategic plan, which many of you have participated in designing the strategic plan for DHSV. We had a public oral sector model of care, and then we saw this as our pathway. And quite clearly, this is about having the consumer at the centre, being part of designing the way we go forward. And to be fair, that's not a place that we've been in before. And we found, and even now we find, we're constantly thinking, did we actually involve the consumer early enough? And quite often we haven't. We think we're doing the right thing in particular spaces, and then we think, whoops, we haven't stood true to having the consumer at the centre of the decision making. So what I'm going to talk a little bit more about now is some of the value mapping process or value stream mapping process we've been to, which is one of the very significant components of that wheel. So part of that was for us to turn around and go, what are we actually doing now? What is our current state look like? And then to design what is the ideal state, which is if we could dream without any constraints at all, what would this world look like in the future? And then to probably bring a bit of reality to it and say, okay, well, we can't actually get away with no constraints. Let's go back to where we think we can be in a couple of years' time. So the first part of the process was a large number of people within the organisation that work all through providing services in emergency and general care actually got together and mapped out what we did. It's a pretty scary map. Because it's quite clear that different patients probably experience different journeys, and it's quite clear that it's very, very messy, and I think that most patients that came through actually deserve a medal for the fact that they can get through our system. And in the hospital, we're probably a lot more complicated than a lot of people in agencies, but even there, I would imagine it's still pretty complicated. So all of that was mapped out, and we've got a room that if anybody wants to come and visit us in what we call the war room, the value-based healthcare war room, or harmony room is another way of looking at it, because we do want to make it a more harmonious future, we've mapped out, and there's little post-it notes all over this wall, but what we've done there is identify what it was like and what the future and the ideal state could look like. But part of the process was also spending a lot of time going out and talking to our client groups and our consumer groups, and they gave us some really, really good feedback. We used the appreciative inquiry technique, and we went out there and we found out from people what did they value when they came in to see us, what did they think that they saw in other places that worked really well, and not necessarily in health but in other environments, and also what were our opportunities for improvement? What could we do better? And it was amazing how consistently similar those different groups were. And the process we're going back through now is just, now that there's been a design for the future state, is going back to those people and saying, did we get this right? So that constant feedback loop of engaging with our consumers to go, is this right? Is this the way that we need to go? So part of the future state, and you don't need to be able to read this at all, it's quite complicated, but taking all those little post-it notes have been now converted into a large plan for this is what the patient journey will look like. And then as a close-up, you can see it looks even, there's a lot of detail there. And the reality is this is only a part of the process. So we're just looking at, this is the process mapping of the future going forward. But it's only a small part of it, and recognising that a lot of this is about how do we make people feel, the experience. What is it going to be like when people come in? What's the experience going to be like for the staff and the providers when they're in there delivering those services? So while it looks like a whole pile of technical boxes, there's a lot in there about how do you make this a really special situation where the value equation is achieved at the end of this. So one of the things we also did in the process was go through and identify a lot of the waste that Norman was talking about before. And I just want to explain an example of it, because part of it, the process mapping is to go through and go, who is doing which bit of the process and what are they doing? And could we actually do better at that bit, or could we transfer it to somebody else that's either cheaper to do it or the most appropriate person to do it, and therefore improving the value all the way along. And one of the examples that everybody looked at was a 30-minute appointment, an examination and diagnosis appointment in the dental hospital. And what they found was of the 30 minutes, a dental assistant was walking for 21 minutes, of which 11 minutes related to developing and taking x-rays, recognising we don't have digital radiography yet. So that won't be the case for everybody. But imagine if 11 minutes of your day you could get back just by having digital imaging. So that's an opportunity for us to improve the value proposition just by using enabling technologies. This is just one example, but a pretty significant example about how you can really redress the way that you're doing things to say, how can I improve the value? And sometimes it was just about where you position things in the clinic, you can actually improve the value and reduce the walking. But when you hear people constantly getting upset because they don't have a dental assistant to assist them, and then you find out they're spending 21 minutes of a 30-minute appointment walking, you're not surprised that they can't assist, because it's pretty difficult when you're out there chasing up things. So there's some real opportunities there for improvement, we found. Just moving on to that, it's really important to think about what we want the world to look like in the future. What is our future state going to look like from the consumer's point of view? And what we want it to do is move from waiting and worried, which a lot of people are, to welcome and safe. So before people arrive, we're expecting them to be really well informed and understand their journey and what they're going to be having. We want them to have been involved in, they've already provided a pile of information to us on our website or through their phone. And this is particularly in relation to providing a whole pile of health outcome data to us so that we actually understand what their state of health is already. So when they arrive, they will know and expect, know what to do and expect where they need to go. Their care will be coordinated and efficient and respectful of their culture and language. What the key thing we want to do is to make sure that people have control, that they are genuinely part of the system where they can help to decide the type of care that they're going to receive, that they feel supported by people. Quite often it worries me when you go into hospitals, and I've worked in a number of different hospitals, and there'll be signs up saying, you know, family are not allowed in the cubicle, or they're not allowed here for this particular event. And yet that's really important. And you look at the emoji and the boards that were presented before. For some people, it's really important to have mum there, or to have some family members or a friend there. Those things are really important. I mean, in hospital land, the concept of visiting hours to me is just crazy. You should allow people to be able to visit most times, unless the person involved doesn't want to be visited at that time, which is also being respectful. So we want people to feel really special. We want them to feel like they're comfortable. And we know that a lot of the barriers of access to dentistry, while some of it's cost and some of it's, you know, there's all sorts of distance and things like that. One of the significant things is fear and anxiety. And some of this is what we're looking at, is how can we help with that? So after they leave, we also want them to be engaged and empowered to look after themselves, because there's no point just doing things to people and then expecting it to be maintained like that forever. So we've got a lot of work to do in that space, as does the consumer themselves. And ideally what we're here for is improving health outcomes. Just from a clinician's point of view, it is a pretty confusing and frustrating environment, so we want to move it to clarity and calm. We want clinicians to feel like they are actually making a difference. That's what we got into the profession for, and that's what we want people to be able to feel that they can be part of. We also want to be able to, for them to have really good relationships with their patients. As you know, that we're in a world where there's a lot more anxiety with the people that come in to see us, and in all our health services. There's things like occupational violence, etc. One of the really important things for us is if we could prevent it by the way we make people feel when they come in, we could make a really big difference to that environment, both for the clinicians and the staff in that environment as well. So a calm environment does make a difference. So it is, and the other thing that's really important is we want to make sure that we have the right people doing the right things, and that we work as a team. And while in dentistry we quite often talk about being part of a team, I've quite often, when I observe people, I notice that it might be one or two people that might be working in a small team environment, but they're not really sure what everybody else is doing. And that's something that we need to change. We need to recognise that there's basically a community of people treating and providing care, and we need to know what one another does. And that's the important thing in this process, that we're all part of designing what it will look like into the future. So from a future state point of view, there is a lot of things that we expect it to look like in the end. And I'm not going to go into a lot of detail about this, but the important thing is that we want to have improved consumer access. We want people to be able to receive much better place-based setting care, so that they get care where they would like to get care as much as we possibly can. We also want them to be able to communicate with us by telephone, by text, by website, whatever is the most ideal way. Are we going to use emojis? Are we not? You know, all the different ways that people want to be able to communicate with us. We want there to be welcome areas and not waiting, and no queues would be ideal. We want comprehensive assessment, so that's where people will hopefully be spending the precious waiting time that they spend now, learning new things, learning how to make themselves healthier, having things provided to them in their own language or in a way that they can understand. I quite often find that the things that we provide to people are not all that easy to understand because they're written in our language, not in the consumer's language. And so we want to focus. This is also an opportunity for knowledge sharing, both from the consumer telling us what they want and what they need, and also for us to share knowledge of what some of the opportunities are. The co-production or the co-design work of the care plan, that's really important. Really hard for us to do that. It's not a way that we've all traditionally probably used before, is to actually be able to give the consumer a much greater say in the sort of care that's going forward. And we need to know what everybody needs to do. There's education and care for better health. So that's about, maximising prevention, maximising early intervention, and also maximising the minimal intervention techniques when we actually have to provide care. Preventive practice, I'm talking about the full upstream and downstream preventive practice. So both population health-based right down to the clinical interventions. Enabling technology, we will be in a world where artificial intelligence will be used to support us, plus electronic medical records, etc. Family friendly, we've talked about that a lot, and you'll hear about that a lot in the next session. We want engaged staff, that's absolutely essential. And lastly but not least, we need better health outcomes. That's what we're aiming to do, and that's what we're expecting to get. Just very quickly, the sort of things that we want to remind ourselves is this is a sort of variation across our state now in the types of services we provide by local government area. We need to reduce that variation because we can't tell you which is right and wrong. We just know there's variation. We need to look at that and see how we can do that better into the future. There's a whole pile of ways or extra work we're doing now in 5 key portfolios, which I won't go into in a lot of detail, other than to say this is the work we're doing at the moment. But that's a large amount of different programs being worked out how we can move forward, and a number of you will be involved in that as well. We're also looking at developing the health outcome measures for oral health, and we're working with ICHOM on that, and the adult set of outcome measures is just about completed. I think I've been saying that for a little while, but I had a meeting yesterday, so it's getting very, very close. And that will be really important for us to measure going forward. The other thing that we've been looking at is a discussion paper on funding models. And in fact, you've probably seen work in the Productivity Commission and recommendations through VAGO that we do need to move away from a DWAL funded model to a more blended payment type model and associated with value-based outcome. This is just a recap of where we started from. This is the value agenda we're trying to achieve. And I think that with a lot of work that people are doing here, and you've been doing for a long time, it's just pulling it all together. We're actually going to achieve better health outcome and better value for all of our patients going forward. And we'll be working in a much better working environment in the future. So thank you very much, and I look forward to being with you on the journey going forward.